My name is Vanessa Judge,
I'm Kiana Roddy.
I'm Deborah Silva.
And I'm Grace Chan.
and we're doing narcolepsy. Okay, narcolepsy is a sleep disorder characterized by uncontrollable sleep attacks, a long-term neurological condition that interferes with the brain's capacity to regulate regular sleep-wake cycles. The sleep disorder narcolepsy confuses the neurological system signals for when sleep and when to be awake. It has a significant impact on everyday life, since it might cause people to suddenly drift off while performing regular tasks like working, eating, or driving. There are two types of narcolepsy. The first type is called narcolepsy type 1, formerly referred to as narcolepsy with cataplexy. This kind of narcolepsy involves one or both of the following signs in addition to excessive daytime sleepiness. First being cataplexy, which is the term for sudden loss of muscular tone or periods of muscle weakness when you're awake. This is typically caused by intense emotion like excitement, laughing, or rage. The second sign is that there's also evidence of low or non-existent CSF hypocretin 1 concentrations, which controls arousal, alertness, and hunger. Some type 1 patients still have type 1 even if they do not have cataplexy, but their hypocretin levels are low. The next type of narcolepsy is type 2, also known as narcolepsy without cataplexy. Patients still have excessive daytime drowsiness, but often it is not emotionally induced muscular weakness. Also, type 2 patients have normal amounts of brain chemical hypocretin and less severe symptoms shown amongst them. There are many kinds of signs and symptoms, but the top 3 signs that are normally shown between the ages of 15 to 25, but possibly experience much younger or older, are excessive daytime sleepiness, which is persistent tiredness. This is most common symptom of narcolepsy. This sleepiness is difficult to prevent and may vary over the course of the day, which can lead to a sleep attack, which is when you can fall asleep for periods of time. Next symptom is sleep paralysis, which is the inability to move or speak while asleep or awake. This symptom lasts for a few seconds to a few minutes. Another sign or symptom is sudden loss in muscle tone, cataplexy. It is caused by excess emotion that trigger muscle weakness, which is usually just in type 1 narcolepsy. However, those with type 2 may also experience sleep paralysis, which is where you lose the ability to move and feel paralyzed, similar to sudden loss in muscle tone.
Narcolepsy is caused by a loss of neurons that produce orexins. Orexin A and B, also known as hypocretin 1 and 2, are neuropeptides created by neurons in the lateral hypothalamus. It is likely that narcolepsy is an autoimmune disorder, a condition in which the immune system mistakes cells or a part of the body as a foreign invader and attacks it. The theory in the case of narcolepsy is that T cells, the type of white blood cells that kill infected cells, attack the orexin neurons. In patients with narcolepsy type 1, there are very low orexin levels in their cerebrospinal fluid. In patients with narcolepsy type 2, though, 90% have normal orexin levels in their cerebrospinal fluid. Type 2 affects about half of all narcolepsy cases, but little is known about its neuropathology. It may be caused by just a partial loss of orexin neurons. In the rare cases where narcolepsy is a result of brain injury, it is the orexin neurons or projections that are damaged. Orexin neurons are involved in many functions, such as arousal, REM sleep suppression, feeding and metabolism, and visceral sensations. Normally, orexins maintain wake by exciting wake-promoting neurons. And during REM sleep, the sublaterodorsal nucleus activates GABAergic premotor neurons to inhibit motor neurons and induce muscle paralysis. Orexin neurons block muscle paralysis during wake by activating the REM sleep suppressing regions that inhibit the sublaterodorsal nucleus from activating these neurons. In narcolepsy, however, this excitement from the orexin neurons is absent, and the amygdala can inhibit the REM sleep suppressing regions, hence the difficulty staying awake and cataplexy. It is unclear how orexins maintain such long periods of wake or what triggers them. The loss in these neurons also doesn't explain everything, such as fragmented nighttime sleep. There are studies that suggest the loss of orexin neurons may trigger compensatory effects, such as increased production of the wake-promoting transmitter histamine and involvement in other parts of the brain, but the results are inconsistent. Narcolepsy-like symptoms seem to run in some families, but the genetic basis for this is unknown. However, we do know that over 90% of individuals with type 1 have the HLA class 2 allele DQB10602, which is associated with a 200 times increase in the risk of developing type 1. There's another allele, DQA10102, which has a similar risk, and another allele, the DPB10501, which also increases the risk of type 1, but has a smaller effect. Studies have also suggested that type 1 is associated with polymorphisms in genes that influence the response of T cells to antigens. For example, there's a specific but rare single nucleotide polymorphism in the TCR genes that may increase T cells' reactivity to fragments of orexin.
Narcolepsy, the good, the bad, and the ugly. Narcolepsy is usually a long-term and chronic condition. Symptoms may develop slowly over a number of years or suddenly over the course of a few weeks. The things that have been suggested as possible triggers of narcolepsy include major stress, hormonal changes like during puberty or menopause, and the swine flu, and also the vaccine of the swine flu has been a known trigger of that. There is no known cure for narcolepsy. With changes in your eating and drinking consumption and in your sleeping habits, possibly taking medication, you can lessen your symptoms and make your life livable and predictable. There are tools that you can help yourself, like a diary, cutting out alcohol and caffeine before bed, and getting regular exercise during the day. As Grace has said earlier, narcolepsy is caused by the lack of the brain chemical hypocretin, also known as orexin, which regulates wakefulness. The lack of hypocretin is thought to be the cause caused by the immune system mistakenly attacking the cells that produce it or the receptors that allow it to work. There is a possible genetic fault, but this does not explain all cases of narcolepsy, and the exact cause of the problem is often unclear. Hypocretins are neurotransmitters, chemicals that transmit signals from a neuron to a target neuron. Hypocretins are only produced by a small cluster of neurons in the hypothalamus, a brain region located roughly behind the eyes and between the ears.
Okay, so some possible treatments for narcolepsy. Unfortunately, there's no cure, but medications can help to lessen the symptoms. Medications are a core therapy for most people with narcolepsy. The ultimate goal is to identify medications that produce the greatest benefits with the fewest problem for each individual. So some stimulants help to stimulate your central nervous system, which can help to keep you awake during the day. Some common side effects include headaches, nausea, nervousness, insomnia, stomach aches, irritability, and weight loss. One stimulant is called modafinil. It is a very effective and popular medication for reducing sleepiness in narcolepsy. It comes in two forms. One is a mixture of active and inactive compounds, and the newer form is a purified active compound. Modafinil likely increases alertness by increasing brain levels of dopamine, a wake-promoting chemical in the brain, for about 8 hours. Unfortunately, it has been linked to irregular heartbeats and increases in blood pressure, so you'll need to be regularly monitored during treatment. It has fewer side effects than some other wake-promoting medications, but it can cause headache, nausea, and occasionally insomnia. Pitolisant is another new and unique medication that can improve alertness across the day. It can reduce cataplexy, hallucination, and sleep paralysis. It increases brain levels of histamine, norepinephrine, dopamine, all of which improve alertness in various ways. It can improve both subject and objective measures of sleepiness, and its effects can last into the evening. Amphetamines and other related medications have been used since the 1930s to improve alertness in narcolepsy and other conditions. All these medications improve alertness by increasing brain levels of dopamine. To a lesser degree, they can also increase brain levels of two other wake-promoting chemicals, serotonin and norepinephrine. Antidepressants mainly suppress cataplexy by increasing levels of norepinephrine and serotonin in the brain. These medications strongly suppress rapid eye movement, also known as REM sleep. Some side effects include feeling agitated, shaky, anxiousness, dry mouth, slight blurry of vision, and dizziness. Sodium oxybate is a sodium salt of gamma hydroxybutyrate, a naturally occurring substance in the brain. Sodium oxybate is a liquid medicine you drink at night in 2 doses. First when you get into bed, and the second 2.5 to 4 hours later. These doses produce sleep through much of the night, and after several weeks of regular use, sodium oxybate usually improves daytime sleepiness and cataplexy. Common side effects include nausea, dizziness, headaches, diarrhea, bedwetting, vomiting, anxiety, and depression. Lifestyle changes along with medication can help make living with narcolepsy more bearable. Taking frequent naps and having a strict bedtime routine help to reduce sleepiness throughout the day. Scheduling short naps at regular intervals during the day also helps, along with naps of 20 minutes during the day, which may be refreshing. They may reduce sleepiness for 1 to 3 hours. Some people may need longer naps. Avoiding nicotine and alcohol, especially at night, since they can worsen your symptoms. These are our sources cited.